Welcome back to EazyMed, where we break down complex medical topics in an easy-to-understand way. Today, we're diving into celiac disease. So let's get started. Celiac disease is an autoimmune disease characterized by damage to the small intestinal mucosa from the ingestion of wheat, barley, and rye in genetically susceptible individuals. Let's discuss the causes of disease. 3 factors are necessary for developing celiac disease: genetic predisposition, gluten ingestion, and an immune-mediated response. About 90 to 95% of patients with celiac disease have human leukocyte antigen (HLA) alleles, HLA-DQ2, and the other 5 to 10% have HLA-DQ8. However, not everyone with these genetic markers develops celiac disease. As with other autoimmune diseases, the tissue destruction that occurs with celiac disease is the result of chronic inflammation. Now let's talk about mechanism of disease. Inflammation is activated by the ingestion of gluten found in wheat, rye, and barley. Gluten contains specific peptides called prolamines. In genetically susceptible individuals, partial digestion of gluten releases prolamine peptides, which are absorbed into the intestinal submucosa. The peptides then bind to HLA-DQ2 and/or HLA-DQ8 and activate an inflammatory response. This inflammation damages the microvilli and brush border of the small intestine, ultimately decreasing the amount of surface area available for nutrient absorption. Damage is most severe in the duodenum, probably because it has more exposure to gluten. The inflammation lasts as long as gluten ingestion continues. Clinical manifestations. Classic manifestations of celiac disease include foul-smelling diarrhea, steatorrhea, fatty stools, flatulence, abdominal distension, and malnutrition. A pruritic vesicular skin lesion called dermatitis herpetiformis is sometimes present and occurs as a rash on the buttocks, scalp, face, elbows, and knees. Celiac disease is also associated with other autoimmune diseases, particularly rheumatoid arthritis, type 1 diabetes mellitus, and thyroid disease. Protein, fat, and carbohydrate absorption is affected. Weight loss, muscle wasting, and other signs of malnutrition may be present. Abnormal serum folate, iron, and cobalamin levels can occur. Iron deficiency anemia is one of the most common manifestations of celiac disease. I hope this video helped you understand celiac disease better. Don't forget to like, share, and subscribe to EazyMed for more informative content on medical conditions and health topics. If you have any questions or topics you'd like us to cover next, drop them in the comments below. Thanks for watching, and stay healthy.